Okay. Hello, everyone. Welcome to our monthly webinar with Latinos in Clinical Research. I'm Judy Galindo, one of the co-founders of Latinos in Clinical Research, along with Ashley, one of our other co-founders. And today we're going to be talking with Axel Narvaez, who has his DNP, which is a doctorate in nursing practice. He's a sub-investigator and rater for clinical research studies at Sun Valley Research Center and a provider at the private clinic, which we're connected to, Sun Valley Behavioral Medical Center in Imperial County. Axel, thank you for being here today. We're excited to learn more about you, your education, your background, your experience, and everything you're currently doing. So tell us more about yourself.
All right. Well, hello, everybody. My name is Axel. Thank you so much for having me. The one who was speaking first has Dan as the name, and I know she's not Dan. I think probably the same thing.
Ashley, sorry. I'm not going. Hi, thank you.
All right. And so she mentioned Nurses Week. So I went to so we had a health fair at the clinic here at Sun Valley, and then last week, the following week after our health day here, there was a health fair in our local college, Imperial Valley College, and I started off by asking, how many people from the audience were nurses, and nobody raised their hand. So it's kind of, thinking about going the direction of mental health, or even going into research, taking the nursing route really isn't one of the main ways of doing so, right? So how did I get into it? Well, it started off when I was very little, and just to make it very brief, right? As far as background, so I am the son of two Mexicans. They met in Los Angeles, which is where I was made. But I've been here in the Imperial County, a rural community, Southern California, right next to Mexicali, which is in Mexico, about 2 hours east of San Diego. I've been here since I was 10 years old, so this is where I consider myself from. And when I was in third grade, this kind of sticks out because that is the age where people started reaching out to me for help, specifically in math, right? And as I got older, I kept helping every year. I remember helping, and math being a subject in which I found myself being good at. And they continued to ask me, even in high school, and I was part of like math competitions and stuff. And why am I saying that? Because that sort of became a passion to me, just sharing knowledge. And ever since then, even after my high school years, I did tutoring, and I did tutoring for about 6 years. I tutored high school kids, I tutored. And then when I got into IVC, Imperial Valley College, I began tutoring for the nursing program there for the pre-entrance exam, which is called the TEAS test. I did some tutoring there. So a total about 6 years. Then I became an RN. And after I became an RN, I went into the ER. That's where I started in a local emergency room. There's only 2 hospitals here in this county. And so I started off in Brawley, Pioneers Memorial Hospital. That's where I started. I continued at the other ER eventually after a few years, but I continued going to school. So then after graduating with my associates as an RN at IVC, I then transferred over to SDSU, which is where I got my bachelor's in nursing. When I was doing clinicals as a nursing student, I just fell in love with the ER, so that's what I went for. Part of it was the adrenaline junkie in me. You get really sick patients, and you literally are helping save people's lives. So this was all new. This was all very exciting to me. But then eventually, I wanted to do more for my patients. So as an RN, you can only do so much. You do a lot for patients, but in a sense, you're following orders from providers, be they physicians, medical doctors, DOs, NPs, PAs, you name it. So I wanted to do more. I didn't always, I guess, agree with treatment plans. And so that's what, and along the way, I had mentors, and I am very thankful for that. I've been very blessed with awesome mentors. And the one who trained me as an RN in the ER, he was actually working toward his NP at University of San Diego, which is a route I decided to take. And that was a big influence, just having him and having another mentor who was also working at it, who was also a professor at IVC for me. He was also He had also graduated from the University of San Diego. So I decided to take that route. I decided to skip the master's. So when you think about a nurse practitioner, most over half of nurse practitioners have their master's degree. Only 2% of nurse practitioners have their doctorate degree. I decided to skip the master's. I decided to go from my BSN to DNP, the Doctor of Nursing Practice at USD, which I'm happy they had that option. Full-time took me 3 years. Tough times. I also had a little one. I had a baby. My baby was born. He's 3 now. The first semester that I started my doctorate program. So I was also working at the time. And so that was very difficult, but I made it, graduated on time, stuck to the plan. And along the way, again, great mentors. I got to follow different nurse practitioners, different clinics, but I was very fortunate to have followed our first Psych MP here in the county. So when you talk about, needing services in your county, being in a rural community, needing all kinds of services, but mental health being one of them. She had already been a nurse practitioner. Her name is Amanda Cuellar, and she had already been a nurse practitioner for years, but she decided to do her Psych MP. So I got to follow her, wiggled my way into there that way. She was still seeing her primary care patients, and also as a new Psych MP, she started seeing mental health patients. So I got to see both sides of that, her primary care patients and the way she did it with her mental health patients as a new Psych MP. This opened my eyes, really. I like that. So in the ER, kind of my background is, you meet a patient, you help them feel better at that point, and then you just bye-bye. You might see them in the future, you might not, but I like that in the clinic. As I got to follow Amanda, she basically built a relationship with her patients. She got to know them. And I wanted to be a part of that. And also, so when it comes to education in nursing, as far as the ladder in education for nurses, the doctorate degree, of course, is basically at the highest of that ladder, and you could take the PhD route, you could take the DNP route. Those are the two main doctorates in nursing. The DNP, the Doctor of Nursing Practice, is that it's focused on clinical practice, versus the PhD, which is focused toward research, specifically research. And so conducting research, organizing it, kind of carrying out that research, whereas the DNP is focused on clinical practice. So using that research that is out there, that evidence, up-to-date information to treat your patients. And so that's the difference in a nutshell. And so for the DNP, so similar to the PhD where you have to do a dissertation, the DNP, you also, at least at USD, they ask for a project, and the project is termed EBP, which stands for Evidence-Based Project. So I got to work on a project for adolescent depression. So teens between the ages of 12 and 17 at a local outpatient primary care pediatric clinic. I was allowed to do my project there. And so I basically, what I did was I looked at the current evidence, did a bunch of research as to what is the best scale to use on adolescents to screen for depression, and use that to see if it actually worked at the clinic. And I did that, and it did actually work, which is another big eye opener for me, because so many kids, so many teens that had already been following up regularly, their depression wasn't caught. There wasn't a standard screening process for depression. And so by adding that, a lot of them were, a lot of depressed teens, basically the depression in the teens where it was detected, they were able to get help for it and be referred out to the appropriate places for that. Here in our county, two big players when it comes to mental health is Imperial County Behavioral Health, and then we have Sun Valley Behavioral Medical Center and the research centers. And so those were two big influencers for me and why I decided to go into mental health. So close to graduation date, I don't remember, maybe Judy can remind me, but I don't remember if it was before or after my graduation, but we got an email from somebody and they were looking for somebody to join the team for both the behavioral medical centers and the research centers. And I saw that email. I quickly reached out to them because my eyes had been open, and so I thought that this was an opportunity for me to help in the way that I could in mental health, our community. And I reached out to them. Interview was set up, and fortunately, I got it. And so I've been here since then. I'm enjoying it a lot. I'm actually very excited to share that I'm a certified FNP, family nurse practitioner, with my DNP, and I'm looking. There's a lot of certifications, or several, when it comes to nurse practitioners, and I just applied to UC San Francisco's psychiatric mental health nurse practitioners program, and I haven't. Basically, I think we're going to hear back next month. I might get in, I might not, but that is definitely my plan. Whether it's there at another school, I want to become certified as a psychiatric nurse practitioner. That's how much I've been enjoying it so far, and I see myself here in the future. I'm also very excited because there's sort of been a push. So I mentioned the health fairs, right? So and it was our first one. So there's sort of a push here in the county to end the stigma when it comes to mental health. And part of that, I think, is not only, reaching out to the community, doing these health fairs, giving them information about mental health services. In the Hispanic communities, it's like, if they hear psychiatrist, psychiatra, or therapist, or anything regarded to mental health, it's like, pa los locos, I've heard that a lot. And I don't know if other providers share my experience, but it's very unfortunate that is a view that a lot of people in the Hispanic population have, is that you got to be crazy to get mental health services, and that's not the case, right? So reaching out and letting them know the services, that it's people like you and I, we all go through tough times, and it's help for those tough times, right? Whether it's losing somebody you love and going through depression or feeling some anxiety, you don't have to be crazy to get mental health services. And so not only is it reaching out to the community, but also training your healthcare professionals. So even within the healthcare profession, there's stigma as far as getting mental health care. Does anybody sort of question or bat an eye when you say you went to your primary care provider? I mean, already it's just kind of a normal thing, but why do people look at getting mental health as something negative, right? So even within the healthcare professionals, it is letting them know like what it's about. So when it comes to hospital, for example, my background, the hospital, and the ER especially, if you get a psychiatric patient, that's kind of the worst of the worst, right? I mean, they're there because they're going through really, really tough times. So it can be suicidal, homicidal, and so that's kind of that's part of the stigma, because when you get psychiatric patients, that's a nurse's experience, that's a doctor's experience at a hospital, anybody who works in a hospital. But then we have the outpatient settings like this one, where we provide services on an outpatient basis, and it's to prevent patients from getting to that point. And so we actually are going to partner up here with San Diego State University, which has an extended campus in both Raleigh, basically our county, 2 campuses here in Raleigh and 1 in Calexico. And they want to partner with us and have students rotate through here. So I think that's going to be very beneficial. They're going to open up, I think, they're going to open up a new program, but I think the program that they're going to open up is in sort of an accelerated program to get their bachelor's in nursing. I think straight from high school. don't take my word on this, but that's my understanding of it. So I believe that for those students, they're going to get to rotate through here to see that side of things. And I'm very excited about that because you're going to get to follow a nurse practitioner, being me and providing these healthcare services or mental health services. They're going to see how it is on this side. And this, I think, is going to contribute toward or to ending the stigma. And I think, well, I did get set up to teach for them as well. They want me to teach mental health there for that new program. And so I'm also excited about that. So
Awesome.
I think
Thank
a
you.
bunch of good things coming.
That's really great. And you've touched on so many important topics. And one is that it's really great to hear that you and then with Judy and y'all's team that you guys are giving that opportunity to students. Because, you know, as you were talking about your education pathway, I think a lot of the scenarios are, I mean, me included, because I was actually a pre-PA, you don't get those opportunities to know that you can go the research route, right? So that's really great that you had that opportunity during your schooling and things like that, that you got to get exposure and you kind of had, were able to end up within research. But you know, definitely something that I wanted to touch on was what you were talking about with stigma, right? Because I used to work in the ER. I was a medical transcriptionist, and I followed the providers, and so I understand what you were talking about with, you know, the psych patients and the stigma and all those kinds of things. And I was just curious, you know, for you having seen both sides in the ER and outpatient, um, have you kind of seen more or less like where the stigma is coming from, and obviously more specifically within the minority community, because I believe that y'all's area is more predominantly minorities. You see that the stigma is more of the issue of like lack of education, or just not necessarily trusting, you know, provider contact and moving forward with research and things like that.
Yeah, so yeah, I don't think it's lack of education, because even among educated individuals, there is a stigma, like I said. And I'm still doing ER part-time. So
Awesome.
I've heard a lot of comments and, oh, you're working in psychiatry, you know, like it's a, like, you know, like it's a bad thing. And like I said, it's very, very unfortunate that means. So these are educated individuals, healthcare professionals, right? So I don't get that from everybody, 100% of the people, but it's pretty often. And so if that is among the educated individuals, healthcare professionals, imagine among the population that isn't educated or doesn't have any healthcare background.
Sure. Oh, we actually have a hand raised. Haiti, so sorry if I mispronounced your name.
Yeah, no, that's fine. It's Heidi. Actually, I do want to touch on that. I think it's really important that that is one of your focus because I think, well, I've seen firsthand in the Latinx community getting, mental services, any type of help is frowned upon. Like I've heard stories from my parents where I'm thinking like, oh gosh, you guys needed some therapy for that. But that's not something that it's either accessible or they're aware that is available, or is just something like, oh well, we don't do that. We figure problems out on our own, and then people suffer for a very long time, and then their kids. So it's like a continuous issue that I have firsthand see within like my own family members or friends of friends in our community that's happening. So it's wonderful to see that that's one of your focuses as well. So thank you.
Thank you. Thank you. Yeah, and you're right. They do let it go on, these mental health problems, until it just becomes, it gets to the point where, we need the help. And at that point, it's just kind of undeniable. And they come for help. And often I see, or I talk to people, parents or just patients, adult patients, and it's like, I wish I would have come sooner. I wish I would have reached out for help sooner before it got to that point. And so that's also very often. So if there is hesitance to just seek out help that has a lot of evidence behind it, right? So there's been just tons of studies on medications. There's first-line treatment, second-line treatment, adjunct medication, there's therapy. There's a bunch of options when it comes to mental health, the clinical trials. But if there's already hesitance to get treatment that's already been around for a while and has a whole bunch of evidence behind it, imagine the research side of it. They look at it as think about it as a sort of experiment. not understanding the phases that there are in clinical trials and how important safety is, and how serious it's taken when it comes to research and clinical trials that we do at the clinic. Here at the clinic, I think we're working on somewhere between 10 and 14. I don't know, maybe Judy has a number.
Yeah, about like 12 trials right now.
No, wow.
Yeah, so they're leaning toward mental health, right? It could be depression, Alzheimer's, ADHD, OCD. There's quite a few, but I think education is a big one as far as that. And I wish I could just pull up Dr. Ng's lecture during our mental health fair, because he talked about these phases of clinical trials, and he did it very, very, very nicely, the way he speaks. And there's a pre-clinical phase, right? You can think of that part as the experiment, but that's not done on people. And then you have the phase 1 on healthy individuals. Once that dose is once a safe dose, if it's a safe medication, is decided on, yes, possibly animals, they go on to humans, and a small amount on healthy individuals, see how they do. Then that becomes the next phase, of phase 2 on a bigger population size. That becomes phase 3, which is even bigger population size after safety is decided. Also efficacy, how effective it is for depression or for whatever you're trying to treat. But as Dr. Ng said, safety being most important. Any little side effect that we notice after starting the medicine, even if we doubt it's related to the medication, we just have to report it. That's part of the safety. And then it gets to the phase 4, which is done on hundreds of people.
Would you say, as a provider, because I know that we speak to many coordinators and site owners and things, but I've always been interested in the provider's perspective, because you're the one that's pretty much doing the communication with the patient, and seeing that you still work at the ER. How would you say the approach is when it comes to teaching your patient, and also not just teaching, but kind of ensuring that they grasp and also feel comfortable with what is needed on their end? How would you say it's different between the ER as opposed to research? Because I do know that for some reason, like some PIs, when they're considering transitioning over, or physicians or mid-level providers that are considering transitioning over, I think there's a lot of concern that it's very, very different. And I know that teaching is a big scope of being a provider in general. So how different is it for you when it comes to research as opposed to just your usual, I guess you could say, rotation at the ER?
Very different, very different. So the ER is the ER. It's really, it's there to, the ER is there to help with emergency situations, right? And if it isn't an emergency where you're told, follow up with your primary, follow up with a specialist. If you broke a bone, and follow up with the orthopedic surgeon or wherever it might be, right? But when a lot of the times when mental health symptoms are brought up, anxiety or depression, if it's severe enough, then you might be evaluated by specialists, right? Here in our county, it's Imperial County Behavioral Health, that they go evaluate the patient and decide whether they say to go home, follow up with them, or they have to be held there, right? But if it's not to that severity, are they going to address your anxiety? Probably not. If you're complaining of chest pain, then hey, let's make sure this person isn't having a heart attack by doing a blood work, an EKG, a chest X-ray, maybe. And then if all that is normal, then you're good to go. But are you going to be prescribed something that's considered first line for anxiety? If that was your complaint, no, probably not. You're going to be told to follow with your primary. So this is what we do here. Those people we can help. And when it comes to research is very different, because it's very meticulous, and you have to follow steps, and you have to report these things, and you have to make sure it's conducted in a certain manner, right? So as a sub-investigator for the research department here at Sun Valley, Dr. Bernardo Ng is a principal investigator, and so he's responsible for making sure that we conduct the research appropriately, take certain steps, the appropriate steps. Again, patient safety is a big concern. So We have to keep safety in mind. And I'm so, as a sub-investigator, I help him with that. So if he's not here and a research patient comes in, needs a physical exam, then I can do that physical exam. I can review labs, I can talk to the patient, I can help decide whether they meet inclusion or exclusion criteria. It all just depends. And sometimes it gets very tricky when it comes to criteria. If they have other health problems, it can get even trickier to see if they decided or not. So we have people that we can collaborate with, be that they're providers that they already see, comparing results. We also have for the clinical trials have a medical monitor. So this is a physician that's that we can reach out to, and they can help us decide whether the patient is a candidate for that study or not. Again, safety being a big thing. And I think just teaching the community about how many, and again, providers have a lot to do with this, right? If I talk to my patient about a possible study for them, I gotta let them know how we take these safety steps so that they're not as concerned. They don't think of themselves as guinea pigs in an experiment, because we don't even do phase 1 or phase 2 trials here. We do phase 3s and phase 4s, and we talk about how much safety is important, and that phase 3s and phase 4s, I mean, the medication at that point is pretty safe.
Awesome. Well, thank you for that. Yeah, it's very important with the teaching and also just the transitioning understanding, especially for providers, right? Is because it's very clear that not just is the diversity and inclusion really important in trials via patients, but in order to sustain that, I also think the next, or one of the biggest barriers we also have to meet is having providers, right? And I'm sure Judy can agree with me on this. Providers that come from diverse backgrounds and that patients can meet on one-on-one with and feel comfortable with, especially if you're dealing with like language barriers, right? And so, I mean, I'm assuming that in your area, because I know Judy spoke about it a lot, that y'all are in a highly diverse population area region, and I'm assuming that you've had multiple patients that have the language barrier that you're constantly having to speak Spanish with, or many other languages, if y'all have other languages in that area.
Yeah, so our population here is about 85% Hispanic, Latino population. And we know that in the United States, it's close to 90%. I'm sorry, about close to 20% of the population. I want to say about 19% is Hispanic, Latino, but less than 5% are involved in clinical trials or in research. Our population here is 85% Hispanic, Latino. So I really am interested, and I don't have any numbers to share with you, but I'm really interested as far as our research department. I don't know if we can pull those numbers up, Judy, somehow, but how many are actually Hispanic or Latino? I mean, keep it in mind.
Yeah, that's actually a good question. I haven't done that in a while. I probably have to do it, but I would say about 80% of those are, probably 70 to 80% are Latinos, bilingual, or Spanish speakers. It just depends.
Oh, great. So it's sort of proportionate compared to the rest of the country. But even then, there's very few. I mean, there's so many studies out there that we're working on, and some don't have any people enrolled in them, which is very unfortunate. So
Yeah,
still,
we believe here at LACR, and I know that today we don't have Chris, Monica, or Dan. A lot of things going on at the moment, so we kind of had to break the team a little bit. But one of the things we believe is that this is a multi-tier prong approach. I know that with sponsors and really with the hype right now in general is inclusion and diversity with patients, but really it's there's so many angles that need to be addressed at one point, right? And multiple points. And I think it's bringing in new, physicians that have diverse backgrounds, getting them more acquainted with research, approaching colleges and universities and introducing this to students that would actually like that alternative route, right? And then ultimately, the patients as well, and doing the full rotation view. And I guess for those that are on here today, if you weren't aware, because I do see some new people in today, So Latinos in Clinical Research, we are also with the Clinical Research Circle, right? The Clinical Research Circle, we have the clinical research, the University of Clinical Research, and in there, one of our motives is to really bring and provide education to the community, right, as much as we possibly can. And one of our more recent ones is the College for Clinicians, right? So this is for NPs, PAs, doctors that want to come in, that want to get educated on research, right? And it's a quick, like, I think 5-week session that they go through, and they pretty much get all the information they need. And so ultimately, LACR, we're here to provide free content, get connected, with individuals like Axiel, right, that are going through, this their phases through research and from beginning of education now into, your actual professionalism as a PhD. And we take these recordings so that, we can go out there and educate individuals interested in the industry, already in the industry, or even potential patients, if that are wanting to know more about research. So it definitely also comes down to us as members, for those that are here today and those that, later watch this recording, and sharing this information, because it's very, very valuable information for people that, don't know much about what's out there. And I apologize, that's a rant, but I don't know, Judy, if you had any more questions.
Yeah, actually, I did. Now that you've been exposed to working in research, you're a provider, you've worked at the ER. Have you run into people who are interested in working in research, or how would you say we go about getting more people into research that are NPs, PAs, doctors, or various other backgrounds that can work as sub-investigators?
So part of it is like what we're doing with NCSU, partnering up with schools, and if the setting there can take students and have students do some hours, I think I have high hopes for this, that students will now consider this as an option for them, and eventually, if they decide to go for higher education of, become nurse practitioners or whatever it may be, medical students. PA students, that they can see this and consider this as an option, and hopefully this sparks interest in those students. But also another part of it is just reaching out to schools and letting them know that if you have, like you did with the University of San Diego, if you have a position, let them know, because a lot of these new grads, new providers are definitely looking for jobs. And that's another way, but and at least that's the way that got me here. Those are just some of the ways I can think of at this moment, but I'm sure there's a ton of other ways. Oh, and another thing I would sort of mention to LACR. First of all, I didn't really know you were out there until I was asked for the interview, right? So, but I think, and I was looking at your page and all the videos, and you do them in Spanish too, and there's so much education you do. I think it's great. Like, consider setting up at the mental health fairs, even our next mental health fair next year, consider being here. That way your information is out there. And I mean, I think it's great. What you do is great. And again, I was looking at your videos and they're awesome. So much.
Yeah, I think that's something we're trying to do in the community, or I'm trying to do more, and kind of promote both the clinic research, Latinos in clinical research. So it's a lot of work, because it's like a grassroots effort, so it takes reaching out 1% at a time. But I think we're doing a lot more this year. COVID kind of held us back. There wasn't a lot of events in the community, but hopefully this year we start reaching more people in our community.
Most definitely, especially we have our amazing Chief Networking Officer here today, Christine. She was actually there at the Diversity Conference in Austin this month. Shout out to you, Christine. Yeah, we're doing everything we can right now to really just expand ourselves as much as possible. We are actually, I think, one of the youngest organizations right now that are out there for research, especially within the diverse community. So we're really doing our best to try to keep up and just move as fast as everybody's also trying to involve us. It's a learning curve, but we're definitely wanting to do everything we can. And one of the ways that we can do that is through you guys, right? You guys keep sharing our posts, telling people to come to our website and subscribe, right? And going to our LinkedIn and really doing us a favor and just, again, sharing and commenting so that we can get that algorithm moving and really get our name out there as much as possible, because we're only going to be able to do as much, so much as we have, eyes and ears and hands going and sharing that information for us as well.
Yeah, and I think it's important, like these videos that we're doing, is that we're highlighting these different positions that exist, right, in research, or people with different backgrounds and how they can get into research, or the ones that are working in research, because a lot of people don't know. I think I remember Dan had sent us a message about, was it an NP or PA, that told them to stop promoting the trainings because they can't work in research. That they didn't know that they can pretty much do what they do in private practice, in research. So I think that's lack of information. They're not aware. So we're trying to share that and at least get more people into clinical research too, that way.
Definitely. Well, thank you so much, Axel, for sharing your path with us and everything that's going on, and we appreciate your nice comments about the organization. We really appreciate it, and doing our best here, and we really would love to have you back on sometime. But yeah, again, thank you so much. And just in case, I know we had one question, but if anybody else has any questions, feel free to chime in real quick.
Sorry, I don't know if there's any questions, but yeah, thank you again for what you do. It's
For
great.
sure.
Consider flyers, because during our mental health fair, I saw some flyers for a service that was being provided by UCLA, and I started giving them out to patients. So I would do the same if I have flyers for you, even though, if I do get a patient that is a Spanish speaking patient, I would definitely refer them to your website and to check out the videos, because the time we have with the patients is very limited. So having something like your page available for them with videos explaining what research is, what clinical trials are, is very helpful. It makes my job easier, when it comes to explaining, but gives them time to consider, look it up, do some research on their own. So I think flyers or some kind of brochure or something would also help. And your merchandise is pretty cool.
Thank you so much.
Getting a mug or something. I was looking at that.
Thank you so much. Oh my gosh, thank you.
Thank you for having me.
Yeah, thank you.
Sure. All right, Judy, I don't know if maybe you kind of wanted to kick off just, a quick update on like the FDA guidelines on diversity and inclusion, and, what exactly, some updates on that.
I think we're gonna save that for another call, because I know
Okay.
Monica wanted to be part of it, and then I'm not sure who else. So maybe we can, and that's probably gonna be a longer discussion, because I think there's so much we want to dive in, and what it means to the industry, to sites, sponsors. So maybe we can set up another time for that.
For sure. Well, then you guys, you heard it here, right? We're going to have another one, another meeting. We'll be updating you either through the email and as well, our social media. So please, if you haven't already added us, go to our website, latinosinClinicalresearch.com. Follow us on the social media so that you can always make sure that you don't miss any of these webinars. This summer, we're going to have a few things, definitely, coming down the pipeline that are really interesting. So please, don't miss out. And also, please, share the content that we have, the recordings. It will go a long way. Share any information you have, and invite individuals to these webinars so that we can meet up, network, and do great things. Awesome. Thank you all so much. You guys have a great week, and till next time.
Thank you. Bye.